Good morning. Welcome to At Your Service on KLAX TV. Brought to you by Heart of Louisiana Credit Union.
Thanks for tuning in to today's edition of At Your Service. Today I'm joined by Donna Lemoyne. She's the surgery director with the Rapides Regional Medical Center. And she's here to tell us about some exciting new technology now available right here in Alexandria.
That's correct. And thank you for having us. We're excited to be able to introduce the Da Vinci to our community. It's the latest in the technology of robotics. First one to be able to bring it to the community, so we're excited about that. Not only is it better for our physicians, but also our patients in the community.
So what's the concept behind Da Vinci?
The concept, when we hear robotics, we're thinking that now robotics are taking over and they're going to do the surgery, and that's not the way it happens. Our surgeons are in complete control of the robot. As they're doing it, they're moving, the robot's moving based off the physician's hands. So it's amazing to watch and to see how well the patients do. There's less blood loss, there's less time on the OR table, and their recovery time is greatly reduced.
And first surgery done recently.
We have. Our first surgery done with the new robotics was on December 21st, right before Christmas. It was our Christmas present to that patient and to our surgeons that they were able to do it. Dr. Meyer Kaplan was our first surgeon to do it in the facility, and since then we've had several more that were very successful with good outcomes. It's an added tool. We're giving them the tools that they need to perform at their best. So it's one more thing that the surgeons can use. They have better visualization, they have better dexterity, they can kind of reach those places that are hard to reach with your hands because they can visualize it better. But for our patient, there's less blood loss.
Right.
There's less time in the OR, less recovery time, and they're back to doing their normal things. And today, that's what we want. We want to fix me and let me go back to work. So this is what this provides.
But patients that utilize this type of surgery need to be ready for a little bit different scenario. It's a little different in the operating room.
It is a little different, but fortunate for all of us, if we ever had to go under a surgical procedure, is that we're asleep, but you have smaller incision. You're not dealing with the large incision, so they do actually do well. Not all patients will be able to benefit from robotics, just like not all patients are able to do laparoscopic. So your surgeon is the one that will decide. It's totally up to them and what meets their needs.
And one of the things you were telling me earlier is that this particular technology features a 4-arm robot as opposed to 3 arms.
Exactly. So you're able to work in multi-quadrants. So your belly is divided into quadrants, so this can, the less time you have to enter the body, the less chance of infection. So you have the 4 quadrants, they can set them up with the 4 robotic arms, and it's better. Technology has improved.
And that wraps up today's edition of At Your Service, only on ABC 31.